Is prednisone 20 milligrams a high dose? Or is it a low dose? What about 40 milligrams? We're going to talk about the answers to many of these questions today. First of all, I'm Dr. Megan, your prednisone pharmacist, and I'm here to provide expert help to support people suffering from prednisone side effects. So let's find out what those might be if you are on high doses. For today, we will go and continue our prednisone side effect series. We've covered common side effects in the past. We've covered psychiatric side effects. We've covered all sorts of different deep dives into prednisone side effects. Today, our deep dive is into high dose prednisone side effects. So we'll start by an overview of a visual representation of what I looked like when I was on prednisone. Then we'll jump into what changes when you go up to 20 milligrams and above. And finally, we'll conclude with where you can find more help. So this is me, this round cartoon with the crazy curly hair. You can see all of these different side effects I personally experienced and what it did to my body. I felt like a stranger in my own skin. It made me feel like I couldn't trust my own brain, and it was a tricky time. I've covered this in a lot of depth in a previous video called Adverse Effects of Prednisone, so check that one out if you want to hear more about this. But it's just an overview really quick so you can see what it looks like to be on prednisone. What kind of a caricature you really become when you suffer from moon face from prednisone. So as I did my research while I was on prednisone, I wanted to know what was going to happen to me, what was actually likely to happen. And so I looked in micromedics and clinical pharmacology and Lexicomp and UpToDate and DailyMed, and I looked in all of these online drug references to find out what I should expect as a patient on prednisone. But what was crazy is they all had different lists. So even though one pharmacy might be looking at one list and another pharmacy might be looking at a different list, they might give you different advice. What I'm going to show you today is what I compiled based on all of these different lists. And you'll see on the left how many sources. So we're going to start with the things that have 5 sources first. And then we'll go down and to 4 sources, 3, down to 1 source, which side effects were only reported in one database. And it doesn't mean that it's more likely to happen just because it's been reported in more than one database. It just means that that's the information that they have to share. So we'll start with 5. So 5 sources. The number one thing that happens when you're on high doses of prednisone is it starts to affect your water balance. It becomes more of a mineralocorticoid. Before it leaned heavier on the glucocorticoid side, which means it didn't affect your water quite as much. But when you are in high doses, it causes all of these things. And so you'll see on each of these slides, the top header, it says retain water. So that's kind of a simpler term for what is below. And then in the navy, the fluid retention, increased plasma volume, and leg edema is what it actually says in those databases. So I tried to simplify it on the top term and use the actual medical term at the bottom. And so each database might have used a different term for each basically of the same thing. So I lumped them together. And so retain water just means swelling, fluid retention, fluid volume changes. So I'm trying to keep it simple. So the number one thing to remember is you retain water. Then the retaining of water leads to high blood pressure. Another word for high blood pressure is hypertension, and having high blood pressure is pretty common on high doses that are used long term. All right, the next thing is the higher the dose, the more likely it is going to affect your emotional state. You might feel crazy, and you just have to remember it's not me, it's the drug. That doesn't mean it's not a real thing. You do need real help with these issues, but it's not you. And so you can feel peace knowing that you are seeking help because you're dealing with a side effect, not because you personally are crazy and have some issue otherwise. It's just a drug side effect. And then, so that was 5 sources. Now we're dropping it down to 4 sources. So those ones were all about just seriously feeling crazy. Now this one is more of depression, so feeling sad. So at high doses, it's more likely to feel depression, and at low doses, it's more likely to feel anxiety. If you want to know more about psychiatric side effects, I have a video series all about that. First is about how prednisone causes it, and then the next one is coping with those side effects. All right, now 3 sources. Back to the original problem of fluid retention, that makes it really hard for your heart. When there's extra blood to pump because there's more water in your blood, it's harder on your heart to do its job. And so normally it could pump and get a certain amount of fluid moved. Now it has to pump harder. And so the consequence is a cascade of heart problems. I'm not going to read all of these, but you can see it's everything from strokes to death, all-cause mortality. And I personally have a friend who died of this. So I know it's real. And the research shows that it's one of the main ways that prednisone can kill people. It's not that likely, but it is more likely at higher doses than at lower doses. So now that was 3 sources. Now we're down to 2 sources that are referring to other heart disease issues, especially relating to the rhythm now. So this is the way the heart beats. So I personally had the palpitations where it's like, well, my heart's beating weird. Like, it's not just da-da, da-da. It's like da, da-da, da, da, da-da. It was just a weird beat. And that's called palpitations. And then arrhythmia is the fancy term for that. And then it can be beating really fast or beating really slow. It can just really do anything. All right. Still from 2 sources, we're going to talk about fat. Now, I personally think this should have been mentioned in all 5 sources. There's no reason that the 3 that didn't mention this didn't do it, aside from they just didn't. And so fat redistribution, I personally think, is one of the most common side effects. It's everything from belly fat to moon face, your face getting round and swollen like the moon, to the buffalo hump on the back of your neck. And moon face is incredibly common. When you are on doses over 80 milligrams, it's really unlikely to not have moon face. It pretty much happens to everyone when you're on very high doses of prednisone. So moon face and other fat redistribution is very common at high doses. And so the higher the dose, the rounder the face, the bigger the belly. The lower the dose, the more likely those things go away. All right, now on to sugar. So sugar changes. So prednisone is a glucocorticoid. That's a fancy term that basically means it's a steroid that messes up the way you use sugar. Normally, you could eat a cake and maybe tolerate it, but while you're on prednisone, it's a lot harder to tolerate the sugars. So, especially refined sugars, and that leads to high blood sugar, which is also known as hyperglycemia, and it affects the fasting glucose levels and the postprandial levels. And that little code there at the bottom stands for a relative risk of 10.3. Basically, you have a 10 times greater risk of having high blood sugar while you're on prednisone at a dose greater than 30 milligrams than somebody who's not on prednisone. All right, now your brain. So your brain on prednisone. This is your brain. This is your brain on drugs. Yeah, prednisone is one of those drugs. And it makes you feel forgetful or have brain fog or amnesia, dementia. And there's a 1% risk of memory impairment that doesn't ever go away. So most of the time, you stop taking the prednisone and the brain fog goes away. But in 1% of cases, it never does. All right. Now we're down to one source, the immune system. And prednisone is often used for this purpose. It is designed by the doctors prescribing it to be used to suppress the immune system. That's why people who have lung transplants, kidney transplants, heart transplants use it, is so that their own body doesn't attack that brand new organ that is saving their lives. I personally used it for this reason too, because my immune system was attacking my own blood, little cells called platelets. And so it's the reason people use it, but it's also a side effect. So it's an indication and an adverse effect at the same time. And that means you might be more likely to get infections. And so you just need to take the proper precautions as far as supporting your immune system. And because I wanted to support my body in as many ways possible, I created the ultimate prednisone checklist. It has the top 25 things to do to support your health while on prednisone, in addition to which questions to ask your doctor about making sure you get checked, so that even though you have to take prednisone to survive, at least maybe you can thrive while you're on it. You can find that at my website. And if you already have it, I'd love for you to share what you've personally done because of that checklist. And if you haven't gotten it, I'd encourage you to go check it out. Signing off as Dr. Megan, your prednisone pharmacist.